Thiotepa, also known as Tepadina Vial, is a medication used to treat cancer by slowing or stopping the growth of cancer cells. It may be given into the bladder to treat bladder cancer and is also used in combination with other medications to prevent rejection of a stem cell transplant. The dosage and timing of Tepadina Vial should be determined by a healthcare professional based on your specific condition and medical history. It is important to follow their instructions carefully for the best results. In order to receive Tepadina Vial, a healthcare professional will administer the medication through an injection into a vein. Sometimes, it may also be injected directly into a tumor. If you experience pain, burning, or redness at the injection site, it is important to notify your doctor or nurse right away. For the treatment of bladder cancer, the medication is usually given directly into the bladder through a tube. Your doctor may advise you to limit your fluids for 8 to 12 hours before the medication is given. The solution is typically left in place for 2 hours and then drained through the bladder tube. It's important to change positions every 15 minutes while the solution is in your bladder to ensure that all parts of the bladder are treated. For certain uses of Tepadina, such as preventing rejection of a stem cell transplant, skin problems may occur as the drug may come through your skin when you sweat. It's important to follow your doctor's instructions on precautions to take and how often you should shower, bathe, and change your bandages. The dosage of Tepadina is determined based on your weight, labs, medical condition, and how you respond to treatment. For the prevention of stem cell transplant rejection, the dosage may also be based on your body size. It is important to learn how to handle, use, and discard chemotherapy in medical supplies safely. Your pharmacist can provide guidance on this. Additionally, it's important to wear gloves and wash your hands carefully after handling this drug. Avoid getting the medication in your eyes or on your skin, and if it does come into contact with your eye, make sure to wash the affected eyes well with water and contact your doctor. If the medication gets on your skin, wash the area well with soap and water. Some common side effects of Tepadina Vial include pain/redness at the injection site, dizziness, headache, blurred vision, fever, nausea, vomiting, loss of appetite, and temporary hair loss. If any of these effects persist or worsen, inform your doctor or pharmacist immediately. Additionally, painful sores on the lips, mouth, and throat may occur. To reduce the risk, avoid hot foods and drinks, brush your teeth carefully, use mouthwash that does not contain alcohol, and rinse your mouth frequently with cool water. Serious side effects may also occur, and it is important to notify your doctor right away if you experience symptoms such as bloody or black stools, coughing up blood, fast or irregular heartbeat, lower back or side pain, difficulty urinating, signs of kidney problems, pink or dark urine, seizures, skin problems, liver problems, or changes in mental/mood. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to consult your doctor or pharmacist if you notice any other effects not mentioned here. Tepadina Vial is a medication that can decrease the function of your bone marrow, which may result in a low number of blood cells, including red cells, white cells, and platelets. This can lead to symptoms such as anemia, decreased ability to fight off infections, and easy bruising or bleeding. Your doctor will monitor your blood tests while you are taking this medication, and it's important to let them know right away if you experience unusual tiredness, pale skin, signs of infection that don't go away, or easy bruising/bleeding. In addition to treating cancer, Tepadina Vial may also increase the risk of developing another form of cancer in some people. It's important to discuss the potential risks and benefits of this medication with your doctor. Remember to take this medication as prescribed and talk to your doctor about the best time to take it and the appropriate dosage for your condition. Before starting treatment with Tepadina Vial, it's important to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. Additionally, make sure to share your medical history with your doctor or pharmacist, especially if you have had bone marrow problems, kidney disease, or liver disease in the past. Tepadina Vial may cause dizziness or blurred vision, and using alcohol or marijuana can intensify these effects. It's important to avoid driving, operating machinery, or engaging in activities that require alertness or clear vision until you can do so safely. Limiting alcoholic beverages is also recommended, and if you are using marijuana, be sure to discuss this with your doctor. This medication can also increase your risk of getting infections or exacerbate current infections. It's important to avoid contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. Before undergoing any immunizations or vaccinations, be sure to inform your healthcare professional that you are using Tepadina Vial. It's also important to avoid contact with individuals who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To reduce the risk of injury, use caution with sharp objects and avoid activities that may lead to cuts or bruises. It's also important to discuss all the products you use with your doctor or dentist before having surgery, including prescription drugs, non-prescription drugs, and herbal products. Tepadina Vial can affect male fertility, and it's important to ask your doctor for more information about this. If you are pregnant or planning to become pregnant, it's crucial to inform your doctor, as this medication may harm an unborn baby. Your doctor may order a pregnancy test before starting this medication, and women using Tepadina Vial should inquire about reliable forms of birth control during treatment and for 6 months after the last dose. Men using this medication should also ask about reliable forms of birth control during treatment and for 1 year after the last dose. If you or your partner becomes pregnant, it's important to speak with your doctor immediately about the risks and benefits of this medication. The effects of Tepadina Vial on breast milk are unknown, and breastfeeding is not recommended while using this medication. It's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Tepadina Vial. This means that it could affect how other medications work or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Tepadina Vial is nalidixic acid. Always consult with your healthcare provider before starting or stopping any medications. If someone has taken too much Tepadina Vial and has severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can reach their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. During your treatment with Tepadina Vial, it is important to have regular lab and medical tests, such as complete blood count, and kidney/liver function tests. These tests should be conducted while you are using the medication and for several weeks after your last dose. It is important to keep all medical and lab appointments and consult your doctor for more details on the frequency of these tests. Make sure to take Tepadina Vial exactly as prescribed by your doctor. If you happen to miss a dose, speak with your healthcare provider to determine the best course of action. This medication, Tepadina Vial, is typically administered in a clinical setting and is not meant to be stored at home. It is used to prepare the body for a stem cell transplant by suppressing the immune system. The dosage and timing of administration will be determined by a healthcare professional based on the individual's specific needs and medical condition. It is important to follow the instructions provided by the healthcare provider for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.